because Emerson is trying to unpack why, or when so many medical professionals were on the front line, why Filipino nurses in particular faced extra danger. Have a listen, have a look.
A significant number of Filipino registered nurses work in acute and critical care areas that include the intensive care unit and the emergency department, which may place them directly exposed or vulnerable to the effects of the new coronavirus. Filipinos have disproportionate rates of chronic illness, such as diabetes and hypertension, when compared with other Asian American subgroups. These conditions have been associated with the severity of COVID-19 symptoms, including deaths. Many of these Filipino registered nurses may be burdened by these chronic disease states.
Janine, I remember in the UK last year, during the early days of the pandemic, the National Health Service discovered that people of colour who were in the medical profession were dying at greater numbers than their co-workers. They took them off the front lines. They made sure that they were safe as much as they possibly could be. What has changed for Filipino nurses now that we've got this information, that we know that you have added risk? You're still working. What's different now?
I think
it can be nothing.
I do not think there's much difference. To be honest with you, there's just more. We just have more information and more knowledge about what we're dealing with compared to when we first started last year.
Yeah.
And there's like the vaccine now and all those things. We have more PPEs now, which is good.
Yeah.
So I don't think there's much difference, but one thing I learned from this though is I have more appreciation and I feel more proud of being a frontline worker and Filipino nurse.
Roseanne, what's different now?
I would have to echo what Janine said, that at my job there hasn't really been much difference. I feel like I am the person who has been telling the statistics to everyone I know, but it hasn't really shaken any kind of changes. Not that I also kind of don't really know how to move forward from here, knowing these really astounding numbers.
Are you scared? Are you more scared now that you've got the information?
I think I'm not more scared. I'm kind of more angry, and I think that's really why I'm pushing for a lot of awareness on this topic. I think not just what is happening now, I also want people to have an understanding of what happened in the past that brought us here, to really have this deeper understanding of this Filipino nursing diaspora. We're not just people who are dying, we're not just statistics. There are people's lives here that are really full. And I want people to also get to know that piece.
I want to bring in one more thought, and this is from Butch de Castro, and it's really about taking action. Once we know this information, how do we act upon it? Have a listen to Butch.
Healthcare organizations must critically examine those factors and decisions that create working conditions that increase Filipino nurses' occupational exposure to COVID. It's not just about the personal protective equipment that's made available to them, but it's also what nursing units they're primarily employed in, what patients they're routinely assigned to, what shifts they're typically given, how many hours they're made to work. And the bigger question that needs to be asked is how institutional discrimination may be influencing these determinations, and thus unjustly subjecting them as nurses of color to disproportionate risk and burden of COVID-related illness and death.
Sally, what would you suggest that we now do with this information, not just Filipino nurses, but the public as well? What next?
COVID has taught us many things. We've put a lot of things in place that have helped us to just get through this pandemic, and some of them have been really brilliant. But what we really have to understand is that these changes that we're making through this discussion are going to make things better for everybody. And I think it's a really important thing. One, to sort of make sure that everybody is staffed appropriately. Two, to make sure that we have the equipment that we need in order to protect us, but also really make conscious decisions about how nursing staff is being distributed and used. You know, nursing's a really tough job. And when you're working at the front lines of COVID, these are areas and situations that we've never been exposed to. So it's important for us to work together to make this whole year something that's really meaningful, but also something that carries us through a post-COVID world. We need to really figure out a better way to be a stronger nursing workforce so that we can both balance the needs of, you know, nurses like Janine right at the front line and nurses in the OR like Rosem together.
Sunny, Janine, Rosem, thank you very much for taking part in our conversation today about Filipino nurses and how they're being disproportionately impacted by COVID than their co-workers. Thank you, YouTubers, for your comments and questions. I have a feeling there are a few nurses in the YouTube comments. Thank you for that. And let me send you to one more place here. This is Kanlugan. This will tell you about Filipino nurses, the tradition in the United States, and also show you some of the extraordinary people who we lost over the past year. Thanks for watching the stream. See you next time.